29-year-old female passenger complaining of severe motion sickness, and she has this prescription for scopolamine, but she doesn't want to take it until she knows more about it.
Okay, I can definitely help out. How are you, miss?
Not so good.
I can tell you a little bit about scopolamine. It's a belladonna alkaloid with anticholinergic properties, okay? It's a lot to take in. Basically what it does is it inhibits the muscarinic activity of acetylcholine in the central nervous system. It also is going to block acetylcholine in the reticular formation and stop the flow of the acetylcholine to the vomiting center of your brain, okay? So essentially, it's going to inhibit that impulse to vomit. Okay?
Well, I'm sorry, go ahead.
No, go ahead.
I was going to say about 2 weeks ago I went to the emergency room because I had chest pain and shortness of breath, and the doctor gave me atropine. So that's an anticholinergic drug, right?
Yeah, so we want to be careful when you take that with scopolamine, because any anticholinergic drugs are actually going to intensify the effect of scopolamine. Okay. Other things you need to keep in mind with scopolamine is that there are some side effects. You might get dizziness or dry mouth, constipation, urinary retention, and in most severe cases you might have a psychotic disorder or glaucoma.
Okay, I don't remember the side effects.
Yikes, we don't need that on this flight.
Absolutely not. My colleague might be able to help you out. You said it was atropine that you took?
Yes.
Okay.
Well, yes, atropine is an anticholinergic drug that has many uses, actually. It is actually very similar in structure and function to scopolamine. Atropine can accelerate the heart rate in certain patients with bradycardia. Heart rate is increased because blockade of the cardiac muscarinic receptors prevents the parasympathetic nervous system from slowing the heart. You would have to have been given atropine through IV 0.5 to 1 milligrams, which may have been repeated as needed every 5 minutes until a total of 2 milligrams was reached. Do you remember if you experienced any side effects?
I don't remember experiencing any side effects.
I did. Atropine gave me constipation.
Uh-oh. Well, unfortunately, the side effects, again, are very similar to those of scopolamine. Both drugs must be used cautiously in patients who may have intra-abdominal infections, chronic hepatic, renal, cardiac, or pulmonary diseases. Do you experience any of these?
No, thank goodness. So can I take the scopolamine now?
Yes, atropine is rapidly effective through IV. In adults, the drug has a half-life of 4 to 5 hours. It's mostly metabolized by the liver, and up to 50% is excreted unchanged in the urine. So if you are given atropine over 2 weeks ago, it should no longer be in your system.
Okay, great, thank you. I'd like to take my medicine now.
Absolutely.
Awesome. Well, hopefully our passenger, will feel better now.
No, I don't know if you need a soda. How were you prescribed your scopolamine? Was it a patch or were you given the tablet?
I was given the tablet.
Excellent. So what we'll do is we're actually going to make sure that you take a patch with the tablet. Okay. That makes it more fast acting. You should be feeling results in about half an hour.
Okay, great. Thank you so much.
You have some patches aboard, don't you?
Yes.
Super. Hello, passengers. There's just been a 500-foot drop, so everyone please take your seats.
Whoa, that's enough to give a girl severe hypertension. What's a gal to do?
Well, for severe hypertension, you could just take a little oral pill called minoxidil. It does have a little black box warning on it, but it is still used for people who have tried safer drugs and they haven't worked. So, how bad is your hypertension?
Let me tell you, it's bad. I've tried everything, including exercise, and nothing's worked.
Well, I'm a nurse, and minoxidil can help bring down your blood pressure because it's a direct-acting vasodilator that promotes intense vasodilation on arterioles, but doesn't affect the veins. Vasodilation results from direct action on vascular smooth muscle.
Ooh, intense vasodilation. Is there anything else I need to know about this drug?
Well, a few things. Minoxidil is usually administered with a beta blocker and a diuretic to prevent increases in heart rate and cardiac output as well as fluid retention, which could lead to congestive heart failure. Also, some patients experience severe hair growth while on the drug. Actually, it can be used topically to promote hair growth in balding men and women.
You know, I use it topically for hair growth, and it works great for me.
Wow, one happy customer. I think I'm going to give it a try.
Well-
Are there any side effects?
Well, there are. Just be sure not to combine it with Imalwong or Yohimbe, and you'll be just fine. And some side effects, like there's myocardial infarction, pericarditis, hyperpigmentation of the skin, rash, nausea and vomiting, weight gain and nephrotoxicity. But other than that, it's fine.
Sounds good. I think I'm going to give it a try.
Great.
Thanks a lot.
Sorry for the bumpy ride, folks. We're going through a storm system right now. It might be a while before the turbulence settles down. Until then, just try to sit back and relax so that...
Excuse me. Oh my gosh, this turbulence is really stressing me out. I suffer from hypertension, and well, look at me. I can't stop shaking. My heart is beating really fast, and I have a really bad migraine.
Oh no, you too? What medication are you taking for your hypertension?
I usually take a Tylenol, but the pharmacy ran out. And so my doctor prescribed a drug called propanol. I don't know too much about it, so I'm afraid to use it.
Oh, not to worry. Propranolol is also used to treat hypertension, among other things. And actually, it can also help you with your migraine headache and your shaking and tremors, too.
Yeah.
Yes.
So how does it work?
Well, propranolol actually works on the beta-1 and beta-2 androgenic receptors of the heart muscle. It inhibits or blocks the action of norepinephrine and epinephrine on these receptors. Norepinephrine and epinephrine are excitatory neurotransmitters that work to raise our blood pressure when necessary, like when we're running or when we're excited. The blockage of these receptors causes the myocardial contractility of the heart to decrease, which then decreases the cardiac output, which then decreases your blood pressure. Cool,
Okay.
huh?
Yeah, cool. Okay, so great. Are there any side effects?
A few. You might feel a little lethargic and dizzy, lightheaded, or have unusual or vivid dreams, but
Okay.
most people feel better after a few days. Other less common side effects, though, are vomiting, nausea, vision changes, depression, and shortness of breath. And if you experience any of these symptoms, or the previous symptoms that I talked about for more than a week, you need to contact your doctor immediately.
Okay, great. Thank you so much.
Sure. Also, if you're taking other beta blockers or cardiosuppressant drugs, make sure and let your doctor know. Many times doctors will combine these drugs for greater effect, but the wrong combination might make you hypotensive. In other words, your blood pressure will drop too low.
Okay, great. Thank you.
No problem.
I don't want anybody to panic, but I just wanted to let you know that we do have some snakes aboard the plane. It's alright because our pilot is a physician and we have many nurses on board. So try not to get bit and enjoy the rest of the flight.
Oh my god, he was bit by a snake and he's not breathing.
Oh my god.
We're gonna have to do an emergency trach and administer acetylcholine.
What is acetylcholine?
Acetylcholine is a depolarizing skeletal muscle relaxant that causes paralysis during surgical procedures or mechanical ventilation. It can be given by IV or a deep IM.
It sounds scary. What are the adverse effects?
There's a lot of adverse effects. It can cause anaphylaxis, apnea, cardiac arrest, hyperkalemia, hyperthermia, respiratory depression, and it can cause death because it causes paralysis of the breathing muscles. So we have to make sure that we monitor the patient's breathing when we administer the drug.
Does it interact with other drugs?
It interacts with a lot of other drugs.
Oh my
It
God.
interacts with digoxin, donepezil, ether, and magnesium. And these can all prolong the effects, produce toxicity, alter neuromuscular blockade, and increase cardiac arrhythmias.
Well, let's get it started.
Yes, let's get the doctor and start the emergency trach.
Hello passengers, I just wanted to give you an update. All of our passengers suffering from severe hypertension and motion sickness are feeling much better now, with no adverse side effects. Unfortunately, we will be having an emergency landing in Mishawaka, Indiana, so that we can stabilize our patient who had the snake bite and was treated with acetylcholine. Thank you so much for your patience. Bye-bye now.
Times are strange. We gotta free up, grateful.